heart attacks, kidney stones, gallbladder infections, appendixes are ready to burst. All of these sorts of things can be actually causing your back pain. I'm Dr. Vikas Puri, president of Intelligent Health Group. As you know, sometimes back pain is not that simple. It's not just coming from your muscles or your joints. There could be an organic reason for your back pain. We call this a viscerosomatic reflex. So visceral comes from the word visceral or organ. Somatic comes from the word body. So anything that's referring pain to your body from that viscera is called viscerosomatic pain or organic back pain. So the issue here is that sometimes people come to our office and they might be coming with a back pain that they've had, and it's significant back pain they're having. And oftentimes what can get overlooked if you don't do a proper assessment is that the problem is actually coming from an organic source. And so you might be missing something that actually could be life-threatening or very serious. For example, bone cancers, multiple myeloma. These sorts of things can be causing the bones to get eaten away, significant back pain developing, and you're just treating it like normal back pain, like mechanical back pain. Meanwhile, it's cancer. Or when you get a heart attack, people just get pain in their shoulder, for example, sometimes, maybe some tension here, and they're thinking it's just, okay, maybe it's just a bit of a strained shoulder. Maybe I just need some physiotherapy, and I need to get rid of like the tension or tightening here in my chest. But meanwhile, you're getting a heart attack. Or if you have a stomach issue, it refers pain right to the back. Again, these are things that we need to make sure that we are aware of. And that's why when you come into our centers, it's really important we do a really bang-up job on that initial assessment, do all the differential diagnoses where we can actually figure out what are the possible things that could be causing this back pain, depending on what's been happening, your history and so forth, and also our physical assessment. Once we've done that, we're able to differentially diagnose what the possible causes are, including organic reasons. And then we can send you for the right testing and so forth, and finally put together that report, which will tell you exactly what's going on, so we get to the root cause of the thing and make sure that you're taken care of efficiently, effectively, with the best results possible. So let's talk a little bit more about organic back pain and spinal pain specifically. For that, let's understand the chart. Let's understand our nervous system a little bit better. Well, our spine literally has 24 vertebrae, and every single level literally plugs in or connects to a different organ system of the body. You can see here the neck area, everything from anything in the head, eyes, ears, nose, throat, your jaw, the inner ear, your thyroid glands, your tonsils. All these things are affected by the upper part of the spine. The mid-spine is really your upper digestive tract, so your esophagus, your stomach, pancreas, spleen, and then your small intestines, etc. start really at the junction between your mid-back and your lower back. Then your lower back, you have all your intestinal intestines, large intestine, appendix, reproductive organs, bladder, and so forth. So if you're ever having problems with any of these organs, having a properly functioning nervous system, we have proper information flow from the spine to the organ is very important. It's going to make sure that area works quickly, better, speeds up natural healing of that area, and just ensures that organ's functioning at its best. In so doing, we can make sure that many things don't need unnecessary drugs or other unnecessary treatments. It's been interesting sometimes seeing people come in with diabetes, and then as a positive side effect of their nervous system working better, and the flow of energy from brain down the spine to that organ system, things like diabetes are better, blood pressure is better, cholesterol is better. Basically, our people who are maybe had infertility before are now conceiving children. It's always beneficial when your nervous system is working at its optimal best. It doesn't mean that's the primary cause of what's the problem or dysfunction, but certainly having your nervous system more tuned can only help your situation. So again, when we talk about pain, remembering and understanding that if you do have any dysfunctions or pathologies in the organs, that because there's a nerve that connects from that organ to the spine, that's where you're going to get that viscerosomatic reflex, right? Where an abnormal signal will go from that organ, from that diseased organ, to the spine, and that will lead to pain. These are called referred pains. Okay, so again, very important that we understand that, and then doing a proper history, understanding your organic health, doing a physical exam, putting that all together is really going to help us understand if that's going on and then to address it appropriately. Regardless, having a properly adjusted spine will just help you with your overall well-being. If you haven't already, please do take advantage of the $49 offer right now for a complete assessment, a complete report of findings, and that first treatment for just $49, normally $200. If you're interested, just comment below and we'll be sure to reach out to you. Thanks.